Hey, this is Dr. Schaefer, and I am going to talk to you right now about assisting with Nexplanon placement. Okay, now, for those of you who aren't aware, Nexplanon is one type of long-acting reversible contraceptive. It's an implant that goes usually in the left upper arm, although patients can opt for the right. It is good for 3 years of long-acting birth control, super effective. And you will probably be asked to assist with either the placement or the removal. So we're going to talk about the placement first because the placement is usually very straightforward and very easy. So as a procedure here at HCHC, you're going to want your client to sign our procedure consent form. Then you are going to want to get them positioned on the table. Usually they do not need to be undressed unless they're wearing something tight or close fitting on the arms. If they're wearing a sleeveless top or a short sleeve, that's ideal. In the case that they're wearing something really tight that doesn't allow access to the upper inner arm, you're going to want to get them into a gown. And then you're going to want to have a chucks to go underneath the arm on that side. And then you're going to want to recline them on the table comfortably. What you're going to want to have in the room is about 3 cc's of lidocaine local. And then for either insertion or removal, you're going to want to get one of the handy women's health procedure boxes. The lid should say exactly what's in here, and it should have most everything you need for the insertion or removal. Please note that when we're inserting a LARC like IUDs or Nexplanon, you do want to take note of the lot number and expiration on the box because that does need to get charted in the patient's medical record. Similar to IUD, you can open up the box before you get started because there is some educational material in here for the patient's medical records about when this was placed, who placed it, where it was placed, so they can put that with their records. But there is a plastic sterile bubble container in here that has the actual inserter, and you don't want to open that until you're ready to go because if the patient did change their mind at the last minute, you would have just wasted a device. So as long as it stays in its interior bubble, it's still sterile. Okay, so your patient is consented, you've got your local. Your provider is probably going to start by looking at the arm and picking a site, and they are going to ask for probably some iodine swabs to clean that off, Hibiclens if the patient has an iodine allergy. You're also going to want to have probably some 2x2s, just some gauze, because after you swab the arm with the betadine, you might want to blot it. Then the provider is going to use their local anesthetic to inject the site, and that does burn and sting a little bit. That's the most uncomfortable part for a lot of patients, is the local. Once that's all done, then you can open up the interior packaging and present the provider sterilely with the inserter. For Nexplanon placement or removal, the provider does not need sterile gloves, so clean gloves is fine the whole time. The provider will then place the Nexplanon under the skin, may hand you the inserter when they're done. That goes in the sharps container on the wall because there is a needle. And then the patient's pretty much done. It's pretty straightforward. So your job then to finish the patient up is to provide them with the sterile dressing that will help them heal. Usually what we're going to ask them to do is to keep the dressing in place at least for 6 to 8 hours to minimize bruising, and then they can take it off and put a Band-Aid over it. Sometimes patients will have a little bit of bruising, but it's usually very minimal. So what you're going to have in your kit are steri strips. You're going to have some antibiotic ointment. You're going to have a sterile bandage roll, and you're going to also possibly have a self-adherent, latex-free roll of wrap. So usually what we do is on the arm actually put like a little bit of steri-strip or antibiotic ointment, and then actually wrap the upper arm in sort of a pressure kind of way. Patient still wants to have sensation in their fingers. Do not cut off circulation, but you do want to have a little pressure there. And then that's it. Usually patients are going to come back in 2 to 6 weeks for a follow-up, see how they're doing with the method. So as I said, placement, very straightforward. Next video, we'll talk a little bit more about removal. Thanks.